Last week, we had a big news articles in Times of India about 15 minutes radio surgery transforms life of a 78-year-old with Parkinson's disease. This has created a lot of questions in a lot of people's mind who are having Parkinson's disease, and many people are trying to know more about this surgery or this procedure, what is being done. So to answer many of these concerns and questions, this video is prepared. We are going to answer what is this and what to know about this procedure. So in this video, we are going to cover about what is this news, its role in Parkinson's disease, and to understand more about this procedure and similar procedures which are being utilized for management of Parkinson's disease. So first, let's see what was written in the news. In the news article, it was written that a 78-year-old gentleman who was having long-term Parkinson's disease underwent a 15-minute non-invasive procedure. I'm going to tell just the keywords here. So, a procedure which was done in 15 minutes. The procedure's name which was done was called as CyberKnife Radiosurgery. And after doing this procedure, in this procedure where a focused X-rays were used to induce a change in the part of the brain called as thalamus. And after doing this 15 minutes of surgery, over 2 days or within 2 days, the tremors what patient was having disappeared completely. So they show that some type of a procedure where there is no surgery was done, that is non-invasive, and a cyber knife means like using X-ray techniques where people, when you undergo radiotherapy, people with many cancer patients undergo this type of procedures commonly. That type of a procedure was done, wherein certain part of the brain was damaged, and this damage led to improvement in symptoms within 2 days after the surgery was done. This is the whole context of the paper news article which is published here. So what is this about? So this, as the topic itself tells, this is called as radiosurgery. Means you are using X-rays or a type of X-ray techniques to use a procedure or damaged part of the brain similar to surgery. So hence it is called as radiosurgery. This is type of a lesioning surgery in a bigger concept. When you look into types of procedures which is done for the brain, this is called as a type of lesioning surgeries wherein involves creating a scar or a tissue damage. And this is what we are going to cover up about, not only about this procedure and context of this procedure with other things. So we are going to talk about lesioning surgeries for Parkinson's disease and other movement disorders. Myself, Dr. Prashant LK, I'm a consultant Parkinson's disease and a movement disorder specialist and trying to give here awareness about the currently published news article. So what we are going to talk about is what is lesioning surgery, what are types of lesioning surgery, what are the benefits and advantages of lesioning surgery, what are the limitations and disadvantages of this procedure. So what is a lesioning surgery? Lesioning surgery involves use of techniques, means something you use which can be, the method can be used either as a chemical or a radio frequency system or a ultrasound guided based lesioning or even stereotactic lesioning is done to create a precise targeted lesion in the specific brain area thought to be responsible for particular set of symptoms. So basically we are going to burn or create a lesion in a certain part of the brain which is not performing better, and we are hoping that by destroying these targeted cells in the brain, the abnormal activity which was happening gets suppressed and people can get relief from the so-called burden of the symptoms what they had. So this is what is called as lesioning surgeries. Are these lesioning surgeries new? No, not at all. Lesioning surgeries are one of the oldest surgeries for various type of neurological disorders. In the early mid 20th centuries, surgeries like prefrontal lobotomy, means they used to cut the part of the brain, were used to treat various psychiatric disorders, and many times people used to have often with severe but unpredictable side effects. But and because of ethical concerns and poor outpatient outcomes, these procedures largely fell out of favor in the early 1900s when these procedures were being done. However, by mid 1900s, that is 1950 onwards, the lesioning surgeries became more and more refined, and targeted lesioning was possible. So people with movement disorders, especially like Parkinson disease, tremors, they started to do specific lesionings of the different parts of the brain, such as thalamus, pallidum, and helping people with severe symptoms related to Parkinson disease or other treatment disorders. But as these lesioning surgeries had their own benefits, but were also associated with limitations, as many of these disorders were progressive disorders, once DBS came into picture in 1990s, many of these lesioning surgeries took backseat or became only utilized in a certain subset of patients in certain very clear-cut indications. This is a picture how lesioning surgeries have changed over a period of time. What you can see here is this was the figure A shows a big lesioning which used to be done in early surgery. They used to almost cut off a part of the brain. You used to get some benefits, but you used to lose some part of the brain. That's what used to have a problem. Then down the time, the type of big lesions what you used to have here became better. And in the figure B, what you can see in the middle, there is a very small lesion, what you can see there, where the lesioning size could be reduced. So benefits can be more and more improvised. And now, in last few years, with the advent of focused ultrasound lesioning, the lesioning have become so small, like a pinhead or less than a pinhead type of lesions we can create in the brain. So this type of lesioning helps us to get focused benefit with minimal tissue damage and reducing the potential side effects for us. So lesioning surgeries have evolved over a period of time. With this evolution of size and techniques, things have been seen in a much better light to help many people with various movement disorders or other neurological disorders to help them to get better outcomes for their issues. So what are the advantages of lesioning surgeries? They are the procedure most of the time is simple procedure. Once the lesion is created, there is no need for ongoing management of implanted hardware. Like in DBS, we put electrode, battery, those type of things which needs to be managed, changed over a period of time is not required. So it's one-time procedure which is done. And usually lesioning surgeries cost generally less than DBS. And effects are almost immediate. Most of the time when you do lesioning surgeries, you see the therapeutic effects are noticed on the surgical table or soon following that. But what are the disadvantages of this procedure? These are irreversible, means whatever damage has been done or whatever the issues have happened to the brain tissue, these are permanent and brain tissues are destroyed. And so if any side effects or complications arise, they cannot be typically reversed, which can be theoretically reversed with DBS by switching it off, let us say. They are less flexible. Unlike DBS, there is no ability to adjust the stimulation parameters after surgery. DBS has the advantage that you keep on changing the electrical parameters and keep on adjusting as the symptoms evolve, or if you have good benefits or side effects, the electrical parameters can be modified. Then the other issue is potentially for larger or off-target lesions. If a lesion extends beyond an intended target, you want to target something and the nearby tissue gets damaged, it can cause unwanted side effects and these cannot be reversed. So these are the general advantages and a general rule of thumb disadvantages in related to lesioning surgeries. Few indications where lesioning surgeries are done in brain include for movement disorders, include like tremor patient, people with predominant tremors, Parkinson disease, dystonia. It is also used for psychiatric disorders such as with obsessive compulsive disorders, low intensity focused ultrasound lesioning for psychiatric disorders is being tried. This is being done for epilepsies, neuropathic pain like trigeminal neuralgias and other indications it is being done. Focused ultrasound guided lesioning is used for mediating blood-brain barrier opening to improve the drug delivery system and management of blood flow to different parts of the brain. These are all being utilized for different types of lesioning surgeries are being utilized in regular day-to-day practice. What are the risks and complications of these lesioning surgeries? Such as bleeding because of the type, based upon type of lesioning surgeries done, there can be internal bleeding in the brain can happen. Possible infection if the surgery involves putting electrode and removing it. Sometimes because of the lesioning surgeries, based upon type of tissue which is damaged, there can be neurological deficits such as weakness of the hand or leg, changes in sensation, that is numbness, paresthesia like sensation, or sensation in the hands, mouth, face can happen. Speech difficulties can be there. Vision problems can develop. This all depends upon which part of the brain is being targeted. Sometimes some people can develop cognition or behavioral changes. All these things is a general perspective. The risk profile depends upon factors like patient health, surgeon experience, and to which part of the brain this lesioning surgery is being done. So these are in general about the benefits and risks of lesioning surgeries. So what are the different types of lesioning surgeries? Because in the recently published news article, they spoke about CyberKnife Radiosurgery. So there are different types of lesioning surgeries are there, which includes radiofrequency lesioning, focused ultrasound guided lesioning, radiosurgery, chemical lesioning, and cryolesioning. These are the 5 known types of lesioning surgeries. Focused ultrasound is one of the currently commonly you would have heard, that is MR guided focused ultrasound guided lesion, that is MRGFUS, which is there. Then you have radiosurgery, that is gamma knife surgery, or similar to that. The currently what patient which has been published in a news article has underwent CyberKnife Radiosurgery. That is that this is the third type of a lesioning surgery what the patient has undergone. So let's talk about each one of these procedures and what it means. So what I'm going to do is, I'm going to talk about each one of these procedures, whether they are invasive or not, means whether there is a surgical procedure involves cutting part of the brain, putting electrode or large anesthesia is required or not. Then I'm going to talk about onset of effect, means after doing the surgery, how soon we get the effect. Then adjustability, whether the procedure is adjustable, means benefits can be modified with time or not. What are the key advantages, key disadvantages, and cost. Okay. And this in the bottom I have given as a comparison with the DBS. That's for understanding purposes to keep in mind. So let's start each one by one. So radio frequency lesioning. Radio frequency lesioning is putting an electrode or we put a small thin electrical rod into the brain. So hence it is an invasive procedure. So a rod goes in and we stimulate there and create a brain tissue injury. As we create the brain tissue injury there, the effect onset of symptom benefits are almost immediate. So you get a good benefit and which can be noticed on the surgical table when the procedure is being done. And this is whatever benefit or side effects you get is non-adjustable. If the disease process involves an ever-changing diseases such as Parkinson disease where symptoms keeps on changing, the benefits cannot be adjustable. Most of the advantage is immediate effect, relatively simple, and it is cost effective. I am using this as a hallmark of costing. So if this cost a certain cost, and this is the most cheapest will be there in each one of the hospitals where you are going to get it done. Disadvantage of permanent lesions, require surgical approach, and risks of off-target lesion means bleeding, targeting other brain tissues we can notice down there. Then the next type is focused ultrasound guided lesioning. What we commonly use is MR guided lesioning or MRGFUS. It is a non-invasive, means there is no need to go to the operation theater. In this case, like MRGFUS, it happens in the radiology room or in the MRI machine room. Benefits are seen on the on the MRI table. And once the benefits are established, usually most of the time they are non-adjustable. The benefits remain or side effects remain over a period of time. The advantage is no incision, no anesthesia is required, and real-time MRI is used because you have a clear-cut correlation between MRI and outcome, what you are going to do. However, limitations is that not all patients can undergo because many people have thick skulls, or so about 20% of the patients have thick skulls, and these patients, the radiosurgery is contraindicated or cannot be utilized. And currently, if you look into in comparison to overall, this is the costliest procedure available as of now from an Indian perspective, Indian cost perspective when we look into it. Then we have radiosurgery, that is gamma knife surgery, or the current news article which has written about non-invasive surgeries. Here, what happens similar to what we do radiotherapies, or similarly what people undergo for brain tumors, the same type of radiotherapy is used, and using that we create a damage in the certain part of the brain. Hence, it is a non-invasive. There is no invasion, brain surgery is not required. The lesion what is caused in the brain by this x-rays what is being utilized, they cause a tissue damage, and this tissue causes edema, and that lesion develops over a time. The evolution of the lesion can vary from weeks, days to weeks to sometime months. Means the size of a lesion can increase over a period of time, and that can be modified. Hence, there is a delayed effect or side effect, whichever way. So many times it takes about weeks to months to see overall effect of the procedure. Similarly, as you can see in our current patient who had underwent, they told that the benefits were noticed over 2 days. After 2 days, all the tremors reduced. And remember that whatever is done is non-adjustable. So we don't have control over here. Unlike in focused ultrasound, the lesion size, what happens from there, it reduces in size. Whereas in radiosurgeries, the lesion size, what happens, can potentially increase over a period of time. And if that potential increase happens for an unwanted structure, you have side effect. If it is nicely develops to the wanted structure, you will have a very good benefit over a period of time. Similar to focused ultrasound lesioning, there is no incision. It's a high accuracy with minimal infection rate because nothing is being penetrated into the skin. But remember that there's a delayed effect, radiation related side effects can be noticed. Many of these things are irreversible, and no real time feedback is there, like with FUS or MR guided lesioning, where we get real time, where we are seeing the MRI and seeing where the lesion is happening and modifying. In radiosurgery, there is no real time feedback. However, this is cheaper or considerably cheaper when compared to the focused ultrasound based lesion surgery. Then we have chemical lesioning. Chemical lesioning is invasive. Once again, we put an electrode or a small rod into the part of the brain, and we put different types of chemicals. It can be alcohol or different types of chemicals. By chemical using, we burn that part of the tissue. By burning, you notice benefit. Usually benefits are quick. However, quick means it takes about hours to days. Benefits are noticed. Currently, this is a very simple low-tech approach which is used for many types of, previously was one of the common for a lot of pain syndromes, or currently also for different types of pain syndromes. It is being utilized and being done. However, poor lesion control, it's commonly outdated, and risk of chemical spread is especially there for movement disorders. And it's one of the cheapest procedures what we can consider for people with various movement disorders. Then we have cryolesioning. Cryolesioning, as the name involves, it is test freezing and killing the certain or damaging the certain part of the brain tissue. So hence it is an invasive procedure. Effects are usually immediate, and once again there is no adjustability is there whatever the outcomes are there. There is minimal risk of bleeding and special, but the limitation disadvantage is that you require a specialized equipment. And because of development of radio frequencies and DBS, the cryolesioning is almost has become outdated procedure for most of the things. So This is what you can see different types of lesioning surgeries, radio frequency lesioning, focused ultrasound based lesioning, radio surgery, that is gamma knife surgery or cyber knife surgeries, chemical lesioning and cryo lesioning. And as compared to DBS, I have also put down the DBS here because many of you will keep on asking how it is in comparison to DBS. DBS is a quite invasive procedure, means we put a small hole, we put the electrodes and stimulate. And effects can be seen immediate when you stimulate it. However, most of the time, these effects modification of electrical stimulation happens over a period of time. So hence, what happens is you overall the benefits may take about weeks to months to get overall benefit. The biggest advantage is adjustability. That is, as the disease progresses, or if you have good benefits or side effects, the electrical parameters can be adjusted to either reduce the side effects or to improve the benefits what you are getting. However, disadvantage is that it's a very long procedure. Implants are there in the body, but sometimes it is some people feel it as disfigurative, and it is also one of the costly procedures for people to be considered and requires a battery replacement down the time based upon type of batteries what they use. So these are all types of lesioning surgeries, how they perform, what are their advantages and disadvantages for all of you to understand. Now, what are the key takeaways by understanding this lesioning surgeries or radio surgeries? What we need to understand down is whenever we consider surgeries is we look into irreversibility versus reversibility. Means irreversible, sometimes you do a tissue damage, you can't do anything get back. So lesioning procedures are mostly permanent and destroy the tissue. And any undesirable side effects are usually not correctable post-procedure. This contrasts with DBS, which is adjustable and reversible. Second is the invasive spectrum. That is, invasiveness. Not all lesioning surgeries are non-invasive or invasive. Focus ultrasound guided lesioning, radio surgeries, that is CyberKnife and others are non-invasive. Means you don't require to have a neurosurgeon or a OT to do it or anesthesia to do it. This can be done in a radiology rooms. However, other surgeries such as radiofrequency, chemical and cryolesioning procedures require a probe or a needle to be put into the brain tissue and hence are invasive, and the risks associated with invasive surgeries will be there. There is also precision and side effect profile what you should keep in mind. MRI guided focused ultrasound is performed with real-time imaging offering excellent precision, and gamma knife also provides sub-millimeter accuracy in many cases what is being done. Radiofrequency lesioning precision depends heavily on intraoperative microelectrode recordings, that is what assessments you are doing, or other type of physiological mapping. Chemical lesioning is the least precise and the most outdated. Onset of therapeutics differ based upon type of surgery is being done. Radiofrequency surgery, focused ultrasound and cryolesioning usually have almost immediate effect during the procedure, it can be noticed. But radio surgeries may take weeks or months to see full effect. What can be seen? The current procedure which was done was a CyberKnife radiosurgery. Always remember, patient selection varies. Lesioning surgeries can be option for patients who are not good candidates for DBS due to various other medical comorbidities or lack of access to long-term DBS programming or personal preference against implants, or even cost also can be kept in mind. Second, focused ultrasound can be ideal for those who desire a one and done non-invasive procedure if skull geometry is favorable. Radiosurgery is often considered when surgical risk is high, that is older patients, high risk of bleeding risk patients for surgeries. But delayed onset must be weighed against the immediate needs. You should remember when you're doing radiosurgeries, effects can develop over a period of time. So people should be able to remember that they need to wait and see before all the benefits, which can take about weeks to months to see what has happened to them over a period of time. So when you remember, in general to remember is the general health of the patient, cost, risks should be kept in mind. The limitations of lesioning surgeries is they cannot be modified if the disease keeps on progressing. Some type of dystonia syndromes, Parkinson disease, they keep on changing over a period of time. And in those cases, we require something which can be modified with time. That would be probably DBS or something similar to that. In some of the disorders, we just require some specific add-on benefit. Like patients with Parkinson disease, purely tremors or predominant tremors affecting them, lesioning surgeries can be a good consideration to help them out in addition to management. Also, we should remember that most of the time lesioning surgeries is done unilaterally only, means only one side is done. Bilateral lesioning surgeries are not done mainly because bilateral lesioning surgeries can potentially cause more side effects in the form of loss of speech, balance, and other issues. Hence, it's primarily limited to unilateral surgery only. But currently, for MR guided focused ultrasound lesion, bilateral surgeries are being considered and are being done with certain benefits with very limited side effect profile, as the lesion caused by MR guided focused ultrasound lesioning is very small in size. So finally, what I would like to tell is that lesioning surgeries, including the current CyberKnife surgery, it spans variety of techniques, each with its own nuances in methodologies, outcomes, and risk profiles. While irreversible by nature, they can provide significant symptom relief for movement disorders, pain conditions, and less commonly for psychiatric disorders. However, please remember modern neurosurgery increasingly leverages DBS for reversible and adjustment management, with lesioning surgery reserved for selected cases or when DBS is not feasible. To remember, when choosing for lesioning procedure, a thorough evaluation is essential. Clinical indications and severity should be clear. That is Parkinson disease, essential tremor, dystonia, refractive. We should be knowing for what we are doing it. We can't do it for everyone. And patient factors, overall health, ability to tolerate surgery or follow-ups, skull anatomy, preference of non-invasive versus invasive makes a difference for patients to decide, and long-term implications. Understanding that lesioning is not an adjustable post-procedure and carries a risk of permanent adverse effect should be remembered by patients when they undergo these procedures. Ultimately, what we should remember is that the decision to pursue any type of ablative surgery, means lesioning surgeries, should involve a multidisciplinary team of neurologists, neurosurgeons, neuropsychologists, and when appropriate, psychiatrists to ensure that approach aligns with the patient's individual risks, goals, and quality of life consideration. That means at the end of the day, patient and their family have to decide what are they expecting, what are the procedure benefits, what are the procedure risks, what are the procedure limitations, and after understanding these things, they should choose whichever procedure they want it and should accept with the outcomes what they receive out of that. Thank you. Thanks a lot. I hope this video gives you an insight into the current confusion which has been arised after the news publication which has come out. And it covers in general about all the procedures in related to lesioning for Parkinson disease more specifically, and generally covers about for various movement disorders, understanding benefits, limitations, including the CyberKnife radiosurgery which has been done in the current patient. Thank you. If any questions or doubts are there, please put it in the comment section.